Good evening, participants and delegates. Thank you for joining Shield Connect today. Today we are back with our series Icons in Conversation with Dr. Ritu, and today we are back with the unique topic that is communication skills in medical practice. And today the icon for the day is Dr. Dilip Gadvi. So before we start with the session, let me give a quick introduction of our ma'am, Dr. Ritu Santwani ma'am. Ma'am is obstetrician and gynecologist.
Just a second, Nishant. Nishant, please stop sharing this screen. Please give the proper introduction for Dr. Dilip Gadvi. Stop sharing this screen and show the screen of the introduction, please. And he's a very big shot of Gujarat. Please properly introduce. Huh?
Yes. I will start with the introduction part.
Yeah.
Okay. So, ma'am is founder and CEO of 360-degree Healthcare Studio and consultant in Inamdar Multiple Specialty Hospital in Pune. And ma'am is also co-founder of MAAN, board member of WSCG. And now let me introduce our icon for the day, Dr. Dilip Gadvi. Sir is obstetric and gynecologist and well-renowned doctor from Gujarat. Sir has been past president of Ahmedabad Obstetric and Gynecological Society. Sir is secretary of Gujarat Obstetric and Gynecology Association. Sir is vice president of Indian Medical Association from Ahmedabad. Sir has been past vice president in IMA, Gujarat State, India. Sir been also secretary of Indian Menopause Society of Ahmedabad chapter. And sir was the organic secretary of IMA NetCon 2014 and national coordinator of AICOG in 2017. And sir is recently the member of a DNV board committee. So we welcome sir on our platform for today's webinar. And I hand over the session to you, ma'am.
Yeah. So thank you, Nishant, and thank you, Shield Connect, for providing the platform. A very, very warm welcome to my dear friend, Dr. Dilip Gadvi. A warm welcome. So we are really grateful to you. We are really grateful to you that in spite of having your busy schedule in such a short notice, you have accepted my invitation. Dr. Dilip is very famous for having his practical talks. His talks are always based on what the practical problems we are having. He's my very great friend. I know he's very super duper busy these days having a lot of conferences, but really we all are eagerly waiting to hear from you. Dr. Dilip, let me tell you, see, some of our friends have joined from Africa and Egypt and Arab countries also to listen to you. So the program is going live on the YouTube. Once the program will finish, I will share a link with you also so you can also share.
Thank you very much.
Yeah, a very, very warm welcome to you. Yeah. So now I'm handing over the dais to you. Yeah.
Yes, friends, very good evening. And just yesterday we had our 76th Independence Day. So I wish you all the very happy Independence Day. And in coming days, we have the Janmashtami, the birth of our Lord Krishna. So I wish you all the best for that also. See, the Dr. Ritu asked me to take lecture on some new subject. I have always seen her taking all the scientific subject in her series, but I am going to take something hatke. It is different than the regular scientific session, though it is related with our day-to-day practice, but it is not absolutely concerned with the scientific. So it is not book session. Most of the people nowadays across the world and India are getting problem because of the lack of the communications. And this is the most important thing which we should learn in our practice, how to communicate with the patient, relatives, our colleagues, and our staff. So I'm going to take lecture on that particular scene. So what is the definition of communication? So this communication is a Latin word. It is the act of conveying the meaning from one entity to another entity by language, signs, and semiotics rules. See, when we are small, we know how we deal with our kid, deal with the parents, and how parents understand what the kid wants. Once he grow up, then he starts speaking, then language come, but he doesn't know how to write. and what is grammatically right. Even if we go to some another country where we have lack of communication with the language, we will talk to the person by signing with each other. So the communication is with us since our birth, and it is only with the human being. The main step of the communications are the motivations, messages, transmissions, reception, decoding of the words, and interceptions. What I want to say you and what you understand, there should be the right interpretation. If it is not interpreted rightly, then the misinterpretation creates a lot of problem in our social life, in our family life, in our political life, or anywhere. So the right word in the right interpretation is a very important thing. Day by day in our practice, we are seeing a lot of assault on the doctors and the hospitals. But the small thing happened in the hospitals, the relatives of the patients and the third party start quarreling with us. So at that time, when you are expert in the communication, if you have good rapport with the patients, patient relatives, you can avoid certain litigations in your practice. So what are the types of communication? By showing the pictures, this can be the visualized, auditory, tactile, electromagnetic, or biochemical. Suppose we are going for the sports, you can see this picture that you are going for the sports. If you are a musician, you can show some musical instrument in your hand, anybody can understand. If you are whistleblower, then can understand you are activist. So these are the signs. See, when we are driving our car, we see lot many signs on the roads also, which indicators or which instructions what should be the speed. There is a hairpin bend, there is a one way. So these are the signs. So signs are also of important in the communication. So when you have a children, for the children 90% of the brain develops by the 6 years, and they have extraordinary communication skill by the God gift. As a children is a kid is already a God gift, but the God has given when we are small extraordinary gift, that by smiling, by laughing, by looking, by staring, the mother can understand what the child want to say to him, and what said child is telling. Mother can understand each and everything by just smiling from the child. So they were 80% communication skill and only 20% technical skill when we are small, from neonate to pediatric stage, that too of the 3-4 years. But in adult, once we grow up, this ratio get absolutely changed. It is 180-degree. It is not Ritu's 360. It is 180. In adult, it is reverse. So then we have very less communication skill and more technical skill, because we want ourselves, we want to earn the money, we want to get. So this is by and large in a broader spectrum. Don't think only from the medical side. So in broader spectrum, become more technical and
I think some net issue from his side.
Yes, ma'am.
Just call him, Nishant, please.
Yes, ma'am.
Nishant sir?
Yes, just now I had a talk with Dr. Dilip Gadvi. He is connecting again.
Okay. Okay.
This is very, very important topic for the communication skills in medical practice. Our whole of practice depends on this, that how you are communicating with each and everyone. So especially in the infertility practice, I think this is very, very important. So what's your experience, the friends who have joined? So how do you think the importance of this topic? If any queries related to this, please do drop in the message box. As soon as the Dr. Gadvi will connect, Dr. Nishant will take the questions. Besides that, next week we are having again a session on 23rd.
And sir is joining again.
Acha, okay, okay.
There was some technical issue.
Okay, okay.
That's all.
I think again it's some problem in connecting. So friends, as I am discussing, then again on the next week, we are a session on 23rd, on next Tuesday. The topic for that, what we have decided is overview of the recurrent pregnancy loss. As I got so many messages in our different academic groups, that for the recurrent pregnancy loss. So I will dividing in 2 to 3 lecture series. Next week, I've invited one of my friends for to take this lecture. So, and I got some other different topic for the discussions for that also. So next week we'll going to discuss about this, the overview about the recurrent pregnancy loss, and after that I will take one of the other lectures related to that, one for the etiology, one for the treatment, one for the what are the recent advances in the treatment. Meanwhile, what are the topics do you want to discuss in this series? So friends, please do drop me the messages. Either in the YouTube, Facebook, LinkedIn, or any of the social media, or in the WhatsApp, those who are connected with me in the WhatsApp, I will definitely try to include that lectures. I think he's not able to join. Okay.
Yes, sir has joined again.
Okay.
Sir, please unmute. Okay. Okay. Yes, sir, we can see you.
But we can't hear him.
Yes.
Network. Unmute.
So you connected from a laptop, so you have to select the audio as a microphone array. So we will able to hear you. We cannot hear you, actually. We can see you clearly.
So please click on microphone so that you can connect with the audio.
You can tell Dr. Dilip to join from the mobile only.
Yes, ma'am.
Yeah, I'm dropping him the message. Actually, I'm able to see that he is joined from 2 devices.
Yes. Saidi,
Yes,
you
sir.
got the PPT, no?
Yes, sir.
So I told doctor to join through phone. He will take the session through phone, and you share this. Okay. Sir, let's share the screen. Sir, we can see your screen.
Okay, can you listen me?
Yes, yes. Now we can hear you clearly.
Yes, yes, loud and clear. Yeah.
Okay, okay.
कोई एक म्यूट करना पड़ेगा.
Okay.
Yeah. Now it's clear.
Patient is, so okay, now if patient is known to you, then just convey your regards to his or her family member. Because in gynec and obstetrics, we know many patients are coming since long. We know many family members also, or in other practice also. So you must say, how is your mother? How is your sister-in-law? How is your brother-in-law? That also create a good intimacy between you and the patient, which is very essential. When something happens wrong, relations help you in making the event smooth. Then your dressing, your etiquette, and the fragrance in the room. Your dressing, you should be well dressed. I'm not telling that you should look like the Shah Rukh Khan or Salman Khan, Hrithik Roshan, but at least one should feel that I am going to the doctor is the most elite class people of the society. Your etiquette, the way in which you are talking, the way in which you are sitting in your chair, the way in which you are writing your prescription, and the way in which you are talking with the patient. So etiquette is also important. And there should be some fragrance in the room instead of odor. Particularly in the gynec practice, the labor room should be away from the consulting because sometimes after delivery there is typical odor in the labor room. So you must have some decency in your practice. There are certain things which is to be avoided. The first, the mobile phone while listening to the patients. When you are talking with the patient or patient is complaining you must be cool, calm, and you should not use your mobile phone. Otherwise, he or she will feel the doctor is not attending me, but he is busy with his mobile. Another thing, that don't use laptop while talking or listening to the patient's complaint or while you are prescribing that drug to the patients. So don't use your laptop for your personal use other than writing the drug, because many doctors have prescribed the drug by computer. So for that it's a different thing. Otherwise, don't use. Avoid watching the TV. See, so far as Guju doctors are concerned, when we are sitting in our OPD, the one TV is always on, and which they show the stock exchange, whether it is in the blue line or the red line or the green zone. So you should not, or you should not see the TV for the news or any update or any one day or any 2020 match. Avoid that. Patient never like this kind of activity when she is or he is sitting in front of your table. So don't do any parallel activity. When you are dealing with the patient, you deal with him or her only. Never do any parallel activity. That also creates a bad impression in the patient's mind. And anything happens to that patient, any accidental thing happened to him, he or she always think that when I was telling my doctor, he was not attending me and he was busy with another activity parallel. There should be slow and sound music in your hospital, in your consulting room, and never discuss any problem, any complaint of the one patient with the another patients. Never say one patient that see the one patient who has left my OPD just outside my consulting room had the same complaint. I treated her like this, and now she is feeling comfortable in bed. Never, never, never say. You must have seen in the lift of the all hospitals. They have categorically put the stickers that don't discuss anything regarding any patient in the lift to anybody. Either patient is serious, not serious, don't discuss. Same thing we have to do in our practice. Never discuss any matter of one patient with another patient, because all the patients are individual, they are different. Though we feel we know, but never try to convince one patient. You said that same patient had this kind of complaint, I treated her and now she is better. Then your communication should be extraordinary with your friends and colleagues. As I said, nowadays, lot of problem we are facing in our practice. Repeatedly, we are seeing many things happening in the practice in different part of India. Assault on the doctor, whether the doctor is culprit or not, relative don't understand. They start fighting with the doctor. They are beating the doctor. They are doing lot of damage in the hospitals also. So always be helpful to your colleagues. When you get the call from your near colleague that my hospital, I am in trouble with patient's relative and something is not proper, always go together there. Your presence will help him by feeling that he will be in the comfort zone. At the same time, many of you may know the relative of the patient and you can convince the other relatives that what has happened, it is not the fault of doctor. So keep good relation with your friends and colleagues at the time when you feel something wrong in your hospital. Don't criticize other without seeing the paper. If you want to say anything about any doctor without seeing the paper, what he has given treatment or how he has treated patient, never criticize. Okay, what he has done is not wrong or what I am going to do is absolutely right. That is a wrong practice. Never compare one case with another in the same situation. That we people know. Every individual is a different. The God has created this many people. We can never see the two similar face. Though twins we see, they are never similar. So don't compare the cases, one case with another. Not to take all supporting evidence from the Google, because nowadays patients are coming to us. They are arguing with us on the basis of Google, but we should not take all the support from the Google. What is written in the Google, it is not the Gita or any religious granth. So please keep Google at the Google level. We must follow the text or what is written in our text. It is the right thing. Always cooperate colleague, or when something happened and somebody go to the court, always be helpful to the court. When court asks you to give certain papers, certain evidences, you must produce in front of the judge. You give your paper, you convince him what you have done for the best in the favor of the patient. Then also judge also not, it is the God who take final decision, not the doctor. But for our defense and our defense, we must provide all the basic paper which court asks us. Always cooperate police when there is a death of the patient in the hospital, because at that time police comes, they may ask certain paper, anything, you must provide it without feeling any guilt. So do the practice ethically. Never try to run away from the work. The main important thing is the staff duty. This is most common thing are happening in the hospital which put us in trouble. You must ask your staff to behave as a staff, not as a consultant. It happens in many hospitals. The senior staff advising patient as if he or she is consultant. So they don't understand the situation. They always compare the situation with the past and they start advising the patients, and that creates a wrong impression, because anytime it happens, patient always think what staff has says is right and doctor is wrong. So that can create a problem for you. He should be in a uniform clothes. When patients are coming, your staff should be in a uniform clothes, in apron, so they can make it out that this person is the hospital staff. Not to disclose anything till the doctor explain to the relative. This instruction should be given to staff. When you tell your patient or the relative that this has happened, I have done this, now patient is comfort zone. After then he or she can say, because always after you go, relative will ask staff nurse or the OT staff what happened in the operation theater, and if she says something different than you, that creates always wrong impression for you and for your practice also. They must monitor and communicate the patient as per record data. The staff has to do his or her activity. He or she should look after the patient, monitor all the data, and should keep it on the paper. When we ask, she or she should publish. Not to make silly jokes with their relatives. Sometimes if you make silly jokes or light things in a lighter moment, when you have good relation, they laugh it. But when anything happened, they always start blaming the doctor tried to flirt me. So be conscious. We never do such kind of thing in your practice. When you are examining the female patient in your OPD, keep female staff with you, keep female attendant with you. When you are doing TVS examination, keep female with you, because anybody can blame you at any time. Then it is you who to prove yourself that you are not that kind of person or you are not at risk. So please never do any mistake by not keeping the female staff when you are examining the female patients. either in medical practice, in gynec practice, surgical practice, or any else practice. Never chat silly jokes or phones or photos by social media with your patients or relatives. Make light jokes with the patient, but in a proper words, so he or she never should misunderstand or should never to misunderstood. See, there are people who were master in communicating. I have put the photographs, the Charlie Chaplin. In those days, it was a silent movie. But even today, we are seeing Charlie Chaplin. We understand what he want to say to us, and we laughed like anything. Gandhi ji, he was very simple speaking person. His English was very simple, very simple. But he was the person who convinced the Britishers and the country of people that he is our leader. Radha Krishna ji has very good sense of humor, very very intelligent man, had very good communication skill. Pandit Jawaharlal Nehru. Now we see the wonderful communication from our present Prime Minister Narendra Bhai Modi. Anything he speaks, it touches the people heart, and that is the beauty that BJP is ruling the country. So your dialogue or your delivery should touch the people, and it should be from the heart. And our legendary leader, Dr. Ketan Desai, who also became the president of World Medical Association, he also has had a tremendous communication skill. Hello, hello.
Yeah. Hi. My screen is hanged. Yeah.
Ah, ah. So the drawbacks, poor communication is a frustrating in your work, in your workplace. It can lead to the poor performance, the lack of teamwork, low moral, and reduced profit. When you are not competent enough in communicating, naturally the one patient will come to you. Next time he or she may not come to you because she feel the doctor is not up to the mark. What I am telling him is either is not able to understand, or even if he's understand, is not able to explain me my disease and my problems. So later on, what happened? Even if a less competent person can earn much money than the competent person, just lack of communication skill. So you must be competent enough in explaining or convincing the patient about his disease and about the trouble. The poor communication issues may lead to social, political, and economical damage to you. This is a very common thing. One who can speak in a nice way, he can communicate it nicely, he can convince them nicely, he can earn the money nicely, he can bring the money to his pocket from the other patient's pocket. Then poor communication skill may be defined as a lack of proper language or accent in the language, slang while one speaks, and it can improve by your practice. So when you feel that your communication power is less, your speech is not properly, you must go to the classes where you can do this. Ritu, as you know, I'm a show follower. जब भी तुम्हें
हाँ,
कहीं भी जलता दिया दिखे, तुम उसके साथ लय हो, उसकी लौ में लिपट जाना, उसकी तरह जलना, तुम रूपांतरित होने वाले हो. So you should be get adjust with the person who is sitting in your room. He or she should feel that we are a part of her or him. Only then and then she will put 100% trust in you and will be helpful to him in your practice. Otherwise, as you know, कसमें वादे प्यार वफा सब बातें ही बातों का क्या, कोई किसी का नहीं है, झूठे नाते हैं नातों का क्या. सब होता है तब कोई आदमी, nobody comes to rescue you, nobody comes to help you. So कहने को तो सब कुछ होता है, but when you face the problem, it is a different thing. And दूसरी ये भी तो है कि बाद में जो होता है, जाने कहाँ गए वो दिन, कहते थे तेरी याद में नजरों को हम बिछाएंगे. At last you feel there is nothing left for you. You are alone in your practice, which give you frustration, and you feel why I become doctor, I should become something else than the doctor. And we have seen many frustrating time in the practice when something happened wrong to you, You run to the for medical legal expert. They advises you, and this is the basic funda of the lawyer. They always make you feared. The doctor always give confidence to the patient. Lawyer always make you feared. See, if you are doing this, this can be happen to you. You can go for the jail. You will be non-bailable. So, if you have a good tongue, if you have good personality, use it. It will be helpful to you in your practice. If you convince the patient in a nice way, it can avoid lot many problem in your practice. You can go do the good practice. You can earn the money, and you can go to the sleep very calmly and lightly. Again, Ichami Dukram, anything happened wrong by me, I'm sorry. I'm again thankful to Dr. Ritu Santwani for inviting me for today's talk. I have given different kind of lecture, which is very practical. When you feel, when you happen, something happen, you remember my words, and I wish you will be taking carry home message from my lecture. Thank you, Ritu, and thank you, the Shield, for that organizing this CME.
Thank you, Dilip, for clearing so many of points. The presentation was really awesome because see, these things are very, very important once we come in the private practice. So yes, today, yeah, the topic is different, and you have changed you're given so many practical tips. I think, especially the doctors who are coming for the starting their private practice, coming into the practice, they will get lot and lot of information from this. Yeah.
Ritu, since last 3 years, in MBBS, they have started this course. Before the first MBBS student going to join the college, the 50
Okay.
days there is a course of communication in the medical practice. But see, when they have entered medical MBBS, they don't understand. Actually, this course should be in the post graduation, because
Very true.
you are facing the problem once after passing out from the MBBS. So this should be for the post graduation, but at last nowadays the NMC has started communication program for the PBS student.
Great, great, great. So thank you once again, Dilip, for sparing time with us. So as you know, the show's name is The Icons in Conversation with Dr. Ritu. So now
Yes.
we have finished the one round of the academic. Now I'm coming for the non-academic portion. So here I am going to ask you some questions, a rapid fire round, where you have to reply me in one word without taking much time.
Yes.
So this is the you can say a secrecy of the show. So
Yes.
now let me know which is your favorite color.
My favorite color is saffron color.
Okay, great. Okay. And you are a tea person or coffee lover?
Yeah.
Tea or coffee?
What?
Tea?
Tea. Yes, I have tea.
Okay, okay, okay. So share with us which is your one of the favorite destination till now where you have visited.
In India or outside India?
Anywhere, wherever you want, wherever you have visited. Only one favorite destination where you have visited.
Himalayan territory.
Okay, great. And the one place where do you like to visit?
Rajasthan.
Rajasthan. Okay, but Rajasthan you must have visited from some of the other conferences, no? Okay, okay. So now suppose for a one day you get a superpower, what will be your aim and motto? For a one day if you get a superpower.
This is the most difficult thing you are asking.
This is rapid fire round, so you have to answer very quickly.
The corruption, the rampant corruption in India should be controlled.
Okay.
Rampant corruption.
Okay.
It should be controlled. That is the only thing.
Okay. So now my last question to you, please share with us some practical tips for the upcoming doctors. I know on your lecture you have shown a lot of the things, but any one thing you want to share with the upcoming doctors?
Ritu, I have seen when we were studying, we did not have all these kind of electronic gadgets.
Yeah.
So we used to talk with each other. We used to play with each other. Since last 15 years, because of the electronic gadgets, of course, we have come to know the world very closely. But at the same time, the man has become alone. He has come out from the people, has become alone. So धीरूभाई said, "कर लो दुनिया मुट्ठी में आ गई है." But the young one, the people are lacking their communications. They are doing chatting with a different person. He's sitting in the India train and will do chat to the USA, but he will not talk to the person sitting beside him. So this is the not proper thing, which we must improve, because we are human being. Why we should not talk with the human being? And instead of that, we are playing with the all gadgets and trying to be feeling happy that I am happy with my all gadget. This is not good thing.
Yeah. So thank you once again, Dilip, for
Thank you.
sharing your excellent this communication skill tips with all of us.
Thank you.
Yeah. So with this, we will wind up for the session for the today. Sorry for some technical
can
glitches.
understand.
Yeah, because there are sometimes some technical glitches
No
are there.
problem.
Yeah. So thank you once
Thank
again.
you. Thank
Yeah.
you.
So
Bye-bye.
bye friends. Please stay tuned with us. On the next week, we are again having a session on the 23rd. That is on the next Tuesday, same 8:30 p.m. Indian Standard Time. Till then, bye-bye.
Bye. Good night.
Good night. Good night.
Bye, ma'am.
Bye. Bye.